we remained 2 doctors and about maybe 4 or 5 nurses. And just about midnight, we start having, God, like a huge amount of patients. Like they were coming in 20s and 30s, and everyone is critically ill. And they're all lying on the floor, and you just don't know where to start from. So each patient will probably have 5 minutes of my time, and either I do it or I don't, and I have to move into the next patient. We had to leave patients to suffer in pain because there were no medications. We had to amputate on a dirty floor because there were no surgical rooms. Equipment, they do not exist. And I know this might sound awful, but it's true, unfortunately. I had to use the same knife, to amputate or do a procedure on different patients. This is a crime, in the civilized world. However, in Palestine, it was just normal. We had to suture kids, infants, 6 months and 7 months and 8 months with no local anesthetics. We had to cut limbs, although these limbs they could have been preserved and they could have been treated if we had the facilities. But unfortunately, it just had to be done in that way. It's either this way or there's no other way. Um, the even when we do the amputation, the saw that we use is it's an electrical one, and it should be disinfected, and we had to use. Do you know the machines that everyone has at home, the drilling machines? The ones they operate on batteries. So literally, these are the ones that we were using. Medications, they do not exist. Analgesia do not exist. Watching kids crying their guts out from pain was something cannot be forgotten. And what was even worse than that is just looking into the parents and their mums, and you could feel everyone's pain. But then there's nothing you can do. It's absolutely nothing. A lot of people, they have died just before we were able to reach them. And as I said, each patient has just got this 5 minutes of my time, and either I can treat or I don't. There's a condition called hemothorax or pneumothorax, which is an accumulation of blood within, the lung. And this one requires a chest drain, a tube, to be inserted into the lung to drain the blood out. In the UK, to do such a procedure, it has to be done under extremely high aseptic technique, and you probably have to examine. Of course, you have to examine the chest before you do such a procedure. These patients were all, because of the noise, obviously, you can't examine properly. But I ended up putting a drain in every single patient who comes through the door. And guess what? Each drain was positive, i.e., was draining blood. And all these procedures, they were done with no anesthetics. You imagine you're getting a knife and you're stabbing it into someone's chest to open a hole to drain the blood. You're doing this procedure with no anesthetics and no disinfectants. And even in my heart, I knew even if I was to treat someone, I know he's going to suffer, in the long term, because there is no aftercare. He's going to die out of infection, because all of the Palestinians are malnourished, lack of vitamins, wound healing is absolutely zero, infection rate is extremely high. And whatever happened, whatever we've seen is not written in books. There is no policy in the biggest trauma center on this earth is able to deal with with such situation. What was even more heartbreaking is the burns. I don't know what chemicals they were using, what type of weapons they're using, because you could feel that the burn is active. It's like they've got this material that sticks onto people's skin that continues to burn. And because of the lack of facilities, we don't know what we're dealing with, what type of chemicals we're dealing with. Therefore, you're unable to provide any treatment. And the screaming from kids, I still can hear it, and what is even more painful is you can't do anything about it. So I know this might sound evil, but you even inside your heart, you wish if this patient dies, because you just don't want him to suffer. There's no burns unit, there is no dressings, there's nothing. Anything you can think of, it doesn't exist. It is nothing. And unfortunately, this is happening in 2025. This is happening where the Jordanian borders and the Egyptian borders, they're only a couple of kilometers away. This is happening where the aid is just literally, just across the border. But because of the evilness of the other side, we were left to suffer while the world is just watching us.